There are 2,600 men diagnosed with prostate cancer in Wales every year. And we know that in some areas they are not well served in terms of holistic support. We wanted to bring services to patients instead of take patients to services, as is usually the norm. So we put a bid in with the Movember Foundation to look at a holistic model on a mobile service. We were successful in that bid, and we converted a 38-foot American van into a mobile support vehicle designed with men in mind. The ManVan team consists of a counsellor, an accredited counsellor, a welfare benefits advisor and a nursing advisor, together with a driver, who turn up at local clinics, in hospitals, but also in rural and deprived areas, of which there are many, unfortunately, in Welsh Valley communities. They make appointments with diagnosed men with not just prostate, but testicular and penile cancer, and also accept men who might just pop along and step on board and have questions about their diagnosis or signs and symptoms that they're concerned about. They can initially talk to the nurse advisor about their worries and their clinical concerns. But then if emotional needs are identified, they can be referred on in that same day to a counsellor to talk about how their diagnosis is affecting them particularly. They can also have counselling with their partner. So if there are any psychosexual issues that are affecting their relationship, they can talk those through in an open and honest way with an accredited counsellor. And finally, sometimes the most difficult part of a cancer diagnosis to deal with is the impact that that diagnosis has on finances and the money coming into a family, particularly when money is tight anyway in times of austerity. The same bills are coming in every month, sometimes increased with a cancer diagnosis, as we know, and not knowing how to access the benefit system, many men never having done that before. Our ManVan Cancer Support Advisor will fill in the forms with them, will make the applications to the Department of Work and Pensions, will fight the case if benefits aren't awarded, and will even go to a tribunal with them if needs be. There's an unwritten rule that men are not good at looking after themselves. And we thought this, and when we launched the van, the service onto the road, we didn't expect the men to turn up. However, we had a number of men who would initially walk around the outside, admire the size of the chrome wheels on the outside, ask about the size of the engine, and then just open up as to their erectile dysfunction issues, really deep things that we didn't think they would go into on a first visit. So as soon as that issue is identified, the nurse advisor is on board and able to answer the questions that they may have. They would complete an EPIC form with them to measure how distressing their signs and symptoms are and what impact those signs and symptoms are having on their day-to-day life. Things like their incontinence issues, any urinary problems at night, for example, any bowel problems as well. And then they would follow that up with regular phone calls to the client and to see if there's been any improvement, talk through treatment options with them, talk through side effects, talk through what is normal and what isn't, and when to consult their clinical team in the hospital. So it's very much a partnership.